Well, thank you for joining us today. We have the privilege of having Dr. Terry Anderson, the founder of CRG, and we're going to cover a lot of different topics, but in this segment, we're going to talk about where did CRG come from as far as why even bother to create the personal style indicator, which is our anchor tool. So Terry, welcome to the show.
Hi, Ken.
Welcome. Appreciate you being here with us.
Sure.
And you know, we've been friends for a long time, but when we think about CRG, and you were teaching as a professor at a university, psychology and counseling, and there were a lot of assessment tools that were out there, Myers-Briggs and DISC and 16PF. What was it that caused you to want to create your own tool? What were some of the experiences that you had with these other tools that caused you to say that I want to create something different?
Well, I was familiar with MBTI, and I was familiar with DISC from having experienced it myself and having used it in classes, and having done some research on DISC and its accuracy and usefulness with government agencies, with hundreds of their employees. And when we found out there was a problem with the internal scoring mechanism with the DISC, I became frustrated because I didn't have a similar tool that I could use in my classes. Because I couldn't, in good conscience, keep using that when I knew it had an internal problem.
Okay.
So I just said to myself, well, this doesn't seem like rocket science. I think that I can actually build one that's more accessible, more useful to students, doesn't require a psychologist for interpretation, and has this kind of instant accessibility and recognition of its validity. So it would have a high face validity right from the beginning. And that's why I designed the first edition and started just putting it together one summer in my basement.
Now, before that, you mentioned you're using DISC, but at that time, so this is late 70s, early 80s, so 78, 79, 80, 81, 82,
right.
Is that Myers-Briggs was there. It's held up by many educational institutions and used by several people or many people now. Why didn't you consider that tool as your option to DISC in your classes?
Well, I just didn't because at that time it required a psychologist for interpretation for each individual, and that's not something that you can do in a classroom setting. At least they didn't have a version at that time that you could do it use it in a classroom setting. And so I also asked a question at a leadership conference where I was a speaker, and there were several hundred people in the room, and I asked them to raise their hand if they had taken the MBTI. Well, more than 2/3 of the people in the room had at one time or another, these are all executives, they had completed the MBTI. Then I asked them to raise their hand again if they remembered their 4 letters. Okay. Well, less than 1/3 of the people in the room raised their hand. And then I asked them to raise their hand again if they used the MBTI model in their daily work or personal lives. Well, out of a couple hundred people in the room, more than a couple hundred, just a handful of people raised their hands. And so I just thought, that's not transferable enough. That learning just didn't stick well enough for me to be confident that I want to spend time with my students teaching them this. Or I want to spend time using it in my own consulting practice. So I looked for other tools and I reviewed what was out there, and I probably looked at 20 different tools. And most of them were psychometric tests. And I wanted to not create a psychometric test, but I wanted to create a communication and learning tool that would have utility for anybody, and particularly for my students in my classes. Something they could use personally and something they could take with them into their workplaces and into their homes.
Yes.
So just as a short story, I remember when I was just photocopying the dot matrix printed version, and I was teaching a class at a university, and I gave the students permission to photocopy it to their heart's content and take it home and give it to whomever they wanted.
So this is the personal style indicator.
This is the first edition.
The first edition that you had
before
created.
I ever even printed it or published it. And the dean came to me and talked with me because there was a concern that so many students had been photocopying this at the university that their photocopier broke down. They went nuts on it, and everybody was photocopying it, and all the students in the dormitories were passing it to each other and talking about each other's profiles. And that's when I realized this is important to them. This really makes a difference in their self-understanding and their ability to communicate who they are and what they're like and what their preferences are to other people. And that was what I tried to measure, was the preference to act in certain kinds of ways, rather than try to predict or test in some kind of psychometric way how people are going to act in the future, even though what we know is that whatever people say they're wanting to act and preferring to act like is actually probably what they usually act like. So that gave that face validity that we were looking for.
So there's that predictability around it. Okay.
Yeah.
Well, I thank you, Terry, for giving us the background of the PSI. And what we're going to do is, if you look on the site, there probably is going to be another segment about just how the PSI was developed and all the background sort of pieces. So I encourage you to take a look at it. But this gives you an insight of just Terry's heart and the search to really have a tool that serves the people, not the psychologist. So we coined the phrase years ago that we create tools that are developed for the learner. And that really, it's Terry, what you did is in that first part with the PSI, say, you know, I'm looking at these other tools. I want to create something that really serves the learner so that they can do something with it and not have an experience like you did with MBTI, where the majority of the individuals didn't remember it and were not applying it.
Right.
And we wanted something, you wanted something that was going to be connected to their heart that they could use for a lifetime.
Absolutely.
Okay. Thanks, Terry.
Yeah, you're welcome.